Around 9 million South Africans have private health care cover through medical aid schemes, while some 51 million South Africans or more only have access to public sector healthcare facilities, which over the years have become strained due to a lack of resources and skilled personnel. The inequalities that are drawn from this reality are quite stark.
We are spending about 4,400 Rand per capita on the public sector. So a patient, roughly per patient, we're spending 4,400. In the private sector, we're roughly spending 25,000 Rand per capita. So gives you an idea, almost 5 times or 6 times the difference is what we're spending per capita.
In the run-up to the creation of the National Health Insurance Scheme, Momentum says it makes sense for the private healthcare sector to alleviate some of the current load on the public health sector by taking on lower-paid workers through low-cost health insurance schemes, for example.
We believe that there are incremental steps to improve public health services, and we think that the private sector must own some of those. And part of that, as an example, is the last bullet point, which is utilizing some of the low-cost insurance solutions that we see now growing, and I'll share some of the numbers a little bit later with you, as an interim step to help alleviate some of that burden that I shared a little bit earlier.
Momentum says there needs to be engagement around the public and private healthcare sectors need to work together to make NHI successful, citing the massive expertise that resides in both sectors, not just in terms of primary healthcare, but also at an administrative level. Healthcare experts often look back at how well the sectors collaborated during the COVID crisis.
In fact, during COVID, the way in which the private and public sector worked together to get vaccines distributed to everybody within the country, I think was remarkable. And so I believe, I'm very positive about it, I believe that same level of interaction and working together can be beneficial. And I think if we both sectors listen to one another's expertise and we're happy to help one another with those expertise, I really do believe we can have a system that makes sense for the benefit of everyone.
Momentum noted that there's an undersupply of healthcare professionals across the country, adding that everything possible should be done to ensure that these professionals don't leave the industry. Anecdotal evidence suggests that a significant number of health professionals are not only leaving the sector, but the country, due in part to anxiety around what the future National Health Insurance Scheme will look like. Nampumelelo Siziba, SABC News.